violence?
I think that the most important thing hospitals can do is probably screen for intimate partner violence. I think there are probably a lot of instances where people are suspicious, but they know that it's going to open up Pandora's box if they get a positive response when they ask a question, so they just don't ask. I think probably educating the clinicians in a hospital too with resources is a really important thing that hospitals can do. A lot of people might say, well, I don't want to ask this question because if the person says yes, I'm being abused, I don't know where to refer them or what to do.
Hospitals and clinics in general need to learn how to screen for abuse. And the screening needs to be done in a way such that it is a very short, not a long time consuming, but short checkoff, and any of those positive answers get referred. So not only do the screening, there also needs to be someone there to respond to it. So if you get a positive screen, you need someone who is an expert in that area or a specialist in that area to actually do the domestic abuse counseling.
Having an awareness of domestic violence allows me as a pediatric practitioner to get a broader sense of the lives my patients have, a better understanding of behavioral issues, other psychosocial concerns that may be related to what's happening in these patients' homes, and to be less judgmental of families who may be going through this, that the chaos that sometimes comes along with this can really have significant implications for children in many different ways at almost any age. And I think the acknowledgement of that and the awareness of that in the medical setting enables physicians to have a more holistic approach to families, where it's more about the whole child, the whole family, than it is about a specific medical illness or a specific behavioral challenge. And it allows us to have the information to dig deeper when we see red flags.
Well, I think providers really need to be educated on how to ask the question and how to get the appropriate history. Also just really educate, especially young people, how to have healthy relationships, how to talk to each other, how to speak to each other in a manner that's respectful, and also how to be able to recognize relationships that aren't building blocks, but actually tear them down.
I think it's important to remember that every person who admits to interpersonal violence or has been a victim of interpersonal violence has their own story, and we need to respect any decision that they make regarding their story.
Also, give residents and physicians training materials to be able to learn how to do that, because we're not taught that in school, so we need to learn how to do that. And a lot of times we don't have a social worker to refer to, but we've got a social worker who has domestic abuse violence background. Yes, we're great.
I think our counselor, Marcella, has really been nice and available for us every time we have patients who screen positive. Yeah, we need such a person because she has more information than I personally know, and what kind of resources are available out there and how to help such families.
Having an IPV counselor in the office has been helpful in a lot of ways. When I started off in this office, we have a lot of patients with a lot of needs here, and oftentimes people come in quite angry, quite difficult to deal with, and in the beginning I kind of reflected that anger back at them, partly because I was a new practitioner and partially because I didn't really know how to respond. And through the years I've discovered, although it might seem obvious, that a lot of these people have a lot of stuff going on in their life, including IPV, and it's really important to take a step back and try to understand that. It's helped having an IPV counselor here. I think that's helped me start to learn to deal with people in a more compassionate way.
I think it's it's helped in a number of different ways. First of all, as I mentioned earlier from the training aspect, I think that probably before I worked at Einstein, I did talk about these issues sometimes with my patients, but I wasn't formally trained, and so I didn't have a lot of skills about the right way to ask questions and specific questions to ask, so it helped with my training. And then it really, really helps to know that somebody is there in the course of a pediatric visit with a patient. Not only do I have to talk about domestic violence, but I have to talk about nutrition, I have to talk about school. There are a lot of issues to cover, and if a red flag comes up with one issue like domestic violence, it's nice to know that there is somebody else there to help, not only who knows more resources than I do and can provide more services, but somebody who has more time, because sometimes I may have 4 more patients waiting for me in the next room, and I really, really do want to help this patient right in front of me. But knowing that there's somebody else who has maybe even an hour to sit with this patient that I don't have is very helpful, and I know they're going to get the care that they need.